And the Fraser Partnership Accord was first signed in 2011 with the aim to ensure all health services provided by Fraser Health are culturally safe. It blends cultural and modern practices to improve health and wellness for all people in BC. And recently, the Métis Nation B.C. signed on. For more on this, I'm joined in studio by the Health Minister for the Métis Nation B.C., Louis de Jaeger. Welcome, Louis.
Hey, Swale, bonjour. Thanks for having me, Abby.
Thank you so much for coming in. Now, the Accord was first established more than a decade ago and then amended in 2020. Why is the Métis Nation BC, only joining it now?
Well, the province is renewing its commitment with the Fraser Salish Regional Caucus and Métis Nation BC to improve health outcomes for Indigenous peoples in the region. And it really is more about relationship building and the relationships that we've had out there with Stolo. And that's what really brought all of this together. When the renewal was coming up, we wanted to start participating. And it was leaders like Doug Kelly. Him and I had a coffee one day, and that really led to, we really need to start taking care of all Indigenous people out there, only just because we're overrepresented, not just on the streets, but in the prison system with addictions. And there's a lot of things that we could do if we start partnering and really bringing that health care to the streets.
And in the past, did Métis feel sort of left out of these discussions, left out, not part of the table as it would be?
Well, in British Columbia, it may be different on the prairies, but we're part of the Métis Nation. But we're a regional government within British Columbia. And not saying that we have title as far as west of the Rockies, but we have had a presence in this province for a long time. But we have also had an issue with identity and our identity crisis with the government of BC and the government of Canada at times as well on just that inclusion part. What does that look like, and what does distinction mean for Métis people living in BC?
And what does it mean for Métis people now to be part of this accord?
Well, nothing's ever easy, but it's all about the people, and the government serves the people. So it's our duty to get out there and say the stats are too high here. We do get some support from the provincial government, and we do have accords with the federal government and the provincial government. But we need to really strengthen that regional sort of health care, and that's where we're starting with Fraser Health. We're starting with this partnership accord to really reach the people and show everybody that this is possible, that we can work together, and this is the best path forward.